I'm very excited to stand today for this second hour to speak on my bill C-284, as you indicated, establishing a national eye care strategy on the second reading. For many years, Canadians have been calling for a comprehensive national plan for vision health, including yourself, Madam Deputy Speaker. You've mentioned this issue many times. Historically, the federal government has lacked any substantive framework on the matter of public eye health care. As it stands, supplementary coverage has only been extended to particular groups of people who qualify for provincial Medicare services. The current structure has created huge gaps in access to care, leaving the majority of Canadians to pay for their eye health care expenses out of pocket, or forcing them to work private insurance packages into their already narrow budgets. I find this system unacceptable. The vision loss crisis in Canada requires a coordinated response, and this is what the National Eye Care Strategy is all about. Here are some of the numbers to give you an even better idea of what is going on vision health in our country. Over 8 million, that's 1 in 5 Canadians, have an eye disease. 1.2 million Canadians live with vision loss or blindness. 1,292 deaths were associated with vision loss in 2019 alone. Meanwhile, 75% of the vision loss cases could be prevented if diagnosed early and have access to treatment. Dr. Arsenoff of Humber River Black Creek told me many stories of people who would have gone blind had they not been able to get immediate attention, because too often we take our eyes for granted. My grandmother died with a blinding eye disease. My longtime friend and mentor also was blind when he died, and my aunt suffers from blindness related to macular degeneration today. So age-related macular degeneration, glaucoma, and cataracts are among the top 5 causes of vision loss here in Canada. AMD affects millions of Canadians and is the leading cause of blindness for those over 55, but it fails to garner the same attention as other common eye diseases. Many of us in this room may also develop age-related macular degeneration, and as part of this bill, I would like to see February designated as Macular Degeneration Awareness Month, to give us an opportunity to focus on just the signs of AMD and what you can do about it. There is a high percentage of seniors and school-aged children who have undiagnosed eye problems. Very few children have had an eye test during the pandemic, and many have also spent an inordinate amount of time in front of computer screens. Even more so, there are many Canadians in need of an eye transplant. So over 3,000 people waiting for an eye transplant. The Canadian Transplant Society actively recruits Canadians to become organ donors, but many people have a myth and a fear about donating their eyes. When polled, over 81% of Canadians respond by saying they would donate their organs, but only 35% actually sign up to do that. Losing one's vision increases mental, financial, social hardship. It can lead to loss of mobility, an inability to live independently, to drive, to read, or to participate in physical activity, and resulting in a loss of social interaction, which can often lead to depression and other mental illnesses. Vision loss has a profound impact on individuals, their families, and society, costing our economy an estimated $32.9 billion a year. $4.2 billion of this cost is attributed to the reduced productivity in the workplace. Over half of that cost, $17.4 billion, is also attributed to the reduced quality of life, primarily due to the loss of independence, especially in the aging population. Over $983 million was spent last year across Canada on injections to treat AMD in Canada. A national strategy for eye care will allow all provinces and the government, as well as healthcare researchers and practitioners, to sit down at one table and jointly develop and implement the measures necessary to make sure that all Canadians from coast to coast to coast have equal access to eye care, no matter where they live. Not long ago, I came across a heartbreaking story of a man who lives in Cambridge Bay, Nunavut. For him, it's been 5 years since he last updated his prescription glasses, even though he's been eligible for a new pair for the last 3 years. He couldn't get an appointment with an eye doctor, and he's still waiting. Some has to do with the pandemic, which caused gaps in people getting in for eye doctor's appointment, but a lot of it is because we take it all for granted. Nevertheless, the fact that access to eye health treatment varies widely from province to province seems so wrong to me. And Bill C-284, I'm hoping to change that. I'm sure many of you have had many similar stories when you start to talk to people about their eyesight. And when did you last get your eyes checked? It's something that we just take for granted, and by the time you find out you have a problem, it is usually too late. Access to eye health care should not be treated as a luxury. It is a crucial service needed throughout all walks of life. Seniors need eye health care to keep themselves capable and protected. Working people needed to stay dedicated to their responsibilities and to not be excluded because of physical ability. And children and young adults need eye health care to study and navigate the world around them. Eye health care means having a safe and enjoyable quality of life. Bill C-284, if passed, commits the government to a national strategy dedicated to improved access to eye care and rehabilitation services, a strategy that also envisions the creation of a vision desk at the Public Health Agency of Canada and investments in research to find new treatments to prevent and stop blindness. The bill is also calling on an enhanced access to eye health care for Indigenous people, for far too long have been neglected and have not had any access to any assistance on eye health care. We take our vision for granted. From social isolation to depression to travel difficulties, there are so many challenges when one can't see. Many people never stop to consider what it would be like to go blind. We have to increase the awareness of vision loss and of what we should be doing every day to protect our eyesight. I would like to see this piece of legislation move as fast as possible. Madam Speaker, as I indicated to all of the support we have here in the House for this bill, the sooner that it can get to committee and get through committee and back here and over through the Senate, it would become law. And I think there are many people across Canada, many of the organizations fighting blindness, CNIB and so on, that are desperately hoping that this time this is actually going to happen. Throughout my 33 years in political office, my mentor, Paul Valenti, suffered from age-related macular degeneration and died 2 years ago. My grandmother, Annie Steeves, was blind most of her life, as is my Aunt Ruby Steeves, who is also blind. So I'm doing this bill for everyone, but especially for them. I'm thrilled that in a position as an MP and on behalf of my family and all Canadians, to truly make a difference by putting forward this bill, which will open the door for more recognition of vision loss and its implications, and of course with the help of all members in this House and all parties that have indicated that they are very supportive. Bill C-284 will have a direct, positive impact on Canadians' vision health now and for generations to come. Many years, optometrists, ophthalmologists, researchers, including patient advocates, have been calling for federal leadership on eye care. CNIB, Canadian Council for the Blind, and Fighting Blindness Canada are just a few of the names. As I mentioned earlier, Madam Speaker, the member for Algoma, Manitoulin, and Kapuskasing, you have been a leader in the fight for vision care in Canada, and I'm very happy to have you in the Speaker's chair today while I do this second reading. We have started many great healthcare initiatives in the Chamber over the past several years, including dental care and pharmacare. The National Eye Care Strategy is the next important step in making the healthcare accessible and affordable for all Canadians. Making eye health, vision care, and rehabilitation services a health priority requires your support. I call on all my colleagues in the House to continue to work together to change attitudes toward blindness to ensure that the 1.5 million Canadians with sight loss are understood and provided the necessary supports. I encourage all of you here today to become champions for Bill C-284. Refer it to the Health Committee as soon as possible. Together we can continue the momentum to help the bill become a law for all Canadians. Thank you very much, Madam Speaker.